I am Nadine Carty-Keynes, and thank you for joining us at the Emergency Operations Center, EOC, on NEVIS, for an update regarding the situation on the novel coronavirus, COVID-19. Today, Monday 25th, we'll bring you our most recent updates. I want to take this opportunity to welcome all our viewers and the media houses that have joined us virtually. All questions, as usual, will be taken at the end of all the presentations. You can view the COVID-19 briefing on NEVIS television at 8 p.m. on Mondays and Thursdays each week, or you can look at these briefings on YouTube or Facebook pages, which is NEVIS Television, NEVIS HBU, and NEVIS NDMD, that is NEVIS Disaster Management. With us today, we have Mr. Brian Dyer, the Director of the NEVIS Emergency Operations Center here on NEVIS, Mr. Lyndon David, Superintendent of Police, NEVIS Division, Dr. Judy Nisbet, Chair of the NEVIS COVID-19 Task Force, and finally, Ms. Sandra Maynard, Director of Social Services Department. Welcome to all. I'd now like to invite Mr. Brian Dyer, who will give his presentation or update.
Good evening, all. The Federation of St. Kitts currently have no active COVID-19 cases, and in that regard, a federal decision was taken to reduce the EOC operations hours. So after 57 days of 24 hours operations, the EOC at the National Emergency Management Agency on St. Kitts and the NEVIS EOC would be activating on a partial or operating on a partial activation. The hours now from today would be from 9 a.m. to 9 p.m. So persons in need of police assistance after 9 p.m. tonight would be directed to call 469-5391 and 469-5392. Health-related matters, you are directed to 311 COVID hotline or the 911 for emergency assistance. Again, the EOC would be proceeding on partial activation as of tonight. We finish our operation at 9 p.m. So persons are asked to contact the numbers mentioned for assistance after 9 p.m. Some statistics. The NEVIS ENC Post Authority has reported that 12 persons have been repatriated to the United States of America between the period of 22nd May and 25th May, which is today, bringing the total to 131 persons being repatriated. With regards to the Compliance Task Force, they have completed a total of 360 assessments and inspections. The breakdowns for these as follows: bakeries and delis 6, banks and financial institutions 13, buses, taxis and ferry 13, game rooms 2, gas stations 7, government buildings and departments 61, laundromats 2, market vendors 4, mechanic shops 13, offices 53, pharmacies 2, restaurants 13, salons and barber shops 19, shops 21, snackets and bars 42, stores 56, street vendors 10, supermarket 7, funeral home 1, gym 2, car wash 3, wholesale 2, radio station and communications 1, and manufacturing 7. Grand total of 360. And finally, I would like to say a special thanks and appreciation to the Royal St. Christopher NEVIS Police Force, the Ministry of Health, and the NEVIS Disaster Management staff who has manned the EOC for 24 hours over the last 57 days. We're now going to partial activation as we seek to get some rest and to rejuvenate our bodies, minds, and souls as we prepare for the onslaught during the hurricane season. Thank you very much. Good night.
Thank you, Mr. Dyer, for your update. I'd now like to welcome Superintendent David, to give his presentation.
Thank you very much, Nadine. Good evening, all. As usual, we start with my stats. Thus far, we have conducted 739 patrols, 70 vehicular checkpoints, 21 arrests were made for curfew breaches, and 10 persons have since been charged for those breaches. We had 13 crimes reported during the period, and out of those 13 crimes, we had made 12 arrests. We have stopped a number of vehicles which amount to 1,848 vehicles. The majority of these persons we realized were essential workers and persons who were given permission to be on the road for varying reasons. Thus far, we have summoned 10 persons. That number has been there for a while, so we realize that a number of persons have been complying. Today, we are now operating under our new regulation, Statutory Rules and Orders, number 19 of 2020, Emergency Powers COVID-19, number 8. These regulations, as we know, they came into effect at 6:01 a.m. on Saturday, the 23rd of May, and they shall expire at 6 a.m. on Saturday, the 13th of June. I will give you an update as to what these regulations are about so that we can have no disputes or confusion regarding them. So the interpretation, when it comes to day of limited operations, it means a period of limited operation of business and enterprise which, A, would be in place from Monday through Friday from 5 a.m. to 8 p.m. as specified in Schedule 1. B, on Saturdays or Sundays from 5 a.m. to 7 p.m. C, where movement shall be exercised in accordance with Regulations 7 and 16, and these deal with the exemptions. Night curfew means from Monday to Friday, the period of curfew with a duration from 8:01 p.m. of one day until 4:59 a.m. of the following day. And B, Saturday or Sunday from 7:01 p.m. of one day until 4:59 a.m. the following day. We are encouraging businesses to continue to lend support to the seniors, persons with disabilities, and essential workers once they produce their identification when they come to patronize your business. We have seen some persons are being careless, and we had to break up a party on the weekend where persons were drinking alcohol and eating and drinking without face masks, and we are of the view that none of them were of the immediate families. We are saying to you, discontinue this practice. Yes, God is blessing us that we have no new cases, but we still have to be careful, be mindful until the health officials would have given all clear, and that has not been given. So continue to practice social distancing and physical distancing. Remember, all retail liquor license premises are still remain suspended. Therefore, there must not be any selling of liquor, and persons should not go on these premises to patronize them. I am pleased to say that with the gradual relaxation of the restrictions and guidance during this state of emergency, the majority of persons on island are willing to comply and have been complying. And I am saying to you, continue to do so. Let us look at Regulation 9 that deals with education and religious instructions. I will just go into it in minute details, and then when Dr. Nisby comes along, she will go in more detail. All educational places and instruction, educational places of instruction shall remain closed. Sub-Regulation 1 does not prohibit any activity referred to therein by electronic or virtual means. So therefore, you can continue to carry out your instructions by Zoom, whatever you have out there, in terms of get it done. So we are encouraging you to continue to do that. 3, all religious places of instruction or worship may function only on Saturday or Sunday, that is a day of limited operation between the hours of 7 a.m. and 5 p.m. Again, I repeat that. Only on Saturday and Sunday the places of worship should meet. Let us continue to follow these guidelines and instructions to ensure that we have no transmission at these places of worship. Also, all services shall begin in accordance with the provisions of these regulations, in particular, Regulation 7, Regulation 15, and Regulation 17, and any other condition or directive given by the COVID-19 task force. Persons who are refusing or failing to wear face masks in public spaces, which cover your nose, your mouth, we are saying to you, comply. You will be prosecuted. We know that many of you do not want to be prosecuted, but we are saying to you, if you continue to fail, you will be. No one is permitted to have private parties or sporting events, an event of this nature where we have social gatherings. Yes, we know we are currently in a period that deals with elections. And we know that they're doing it by virtual means. So we are saying that they too are complying with these regulations and guidelines. I will just read Regulations 16 and 17 just for clarity. And they deal with funerals and weddings. Funeral and weddings. Regulation 16:6. It says here, notwithstanding Regulation 10, during a day of limited operation, a person may attend a funeral except A, no more than 25 members of the immediate family should be in attendance. B, no more than one officiant should be in attendance. C, only essential mortuary personnel should be in attendance. D, the funeral shall have a maximum duration not exceeding 1 hour. I will stay there. I do hope that persons who are in the funeral business and persons who have death, you comply, and if you need more, you can call or obtain a copy of the regulation. And we have 7, sub-regulation 7, which pertains to weddings. It states, notwithstanding Regulation 10, during a day of limited operation, a person may attend a wedding except no more than 25 persons shall be in attendance. No more than one officiant should be in attendance. Only essential camera technicians should be in attendance. Only 2 essential witnesses should be in attendance. The wedding shall have a maximum duration not exceeding 1/2 hour. And all persons except the bride and groom shall adhere to social distancing and physical distancing protocols. You know, you have to give that kiss. Also, is to let persons know again, beaches are open up from 5 a.m. to 10 a.m. We have where Regulation 17, exceptions for fishers during the night curfew. During a period of night curfew, snapper fishers and longliners may operate and shall adhere to social distancing and physical distancing protocols pursuant to Regulation 7 as far as reasonably practicable. I prefer to get these out because these are persons who continue to ask the police, ask the EOC, disaster, and Dr. Nisbet regarding their profession. And we are saying to you, the regulation have spoken to this, the decision makers have listened, and they have given it to you. Regulation, sub-regulation 13 of Regulation 16. This one pertains to restaurant and fast food vendors, so to speak. Now, here what it says. During a period of limited operation, restaurants and takeaway food vendors may operate only for the purposes of food delivery or food takeaway services. I repeat, Regulation 16, sub-regulation 13. During a day of limited operation, restaurants, and takeaway food vendors may operate only for the purposes of food delivery or food takeaway services. Let us adhere to these and ensure that we are seeing, slowly but surely, we are getting there. Thank you very much.
How to put on a face mask. Clean your hands with soap and running water or hand sanitizer before touching the mask. Remove a mask from the box and make sure there are no obvious holes or tears in either side of the mask. Determine which side of the mask is the top. The side of the mask that has a stiff, bendable edge is the top and is meant to be molded to the shape of your nose. Determine which side of the mask is the front. The colored side of the mask is usually the front and should face away from you, while the white side touches your face. If you're wearing a mask with ear loops, hold the mask by the ear loops and place a loop around each ear. Mold or pinch the stiff edge to the shape of your nose. Pull the bottom of the mask over your mouth and chin. If you're wearing a mask with ties, bring the mask to your nose level and place the ties over the crown of your head and secure with a bow. Then take the bottom ties, one in each hand, and secure with a bow at the nape of your neck. Pull the bottom of the mask over your mouth and chin. How to remove a face mask. Clean your hands with soap and running water or hand sanitizer before removal of the mask. Avoid touching the front of the mask. The front of the mask is contaminated. Only touch the ear loops, ties, or band. If you're wearing a mask with ear loops, hold both of the ear loops and gently lift and remove the mask. Throw the mask in a covered trash bin. Clean your hands with soap and running water or hand sanitizer. If you're wearing a mask with ties, untie the bottom bow first, then untie the top bow and pull the mask away from you as the ties are loosened. Throw the mask in a covered trash can. Clean your hands with soap and running water or hand sanitizer.
Thank you, Superintendent David, for your update. I'd now like to welcome Dr. Judy Nisbet, Chair of the NEVIS COVID-19 Task Force, to give her updates.
Thank you, Madam Chair, and good evening to everyone. Our statistics have remained the same for the past week, with 124 persons tested, 120 tests being negative, 4 tests positive, and no pending test results. There are no active cases, and no one is in quarantine. As Superintendent David said, SR&O number 19 of 2020 were released on Saturday, 23rd May. And churches have been given the option of reopening if comfortable doing so. Reopening is not compulsory, but it's an option. Church leaders are still encouraged to use virtual means of reaching their congregations, such as broadcasting their services on social media, such as YouTube and/or Facebook, or video conferences such as Zoom, or via radio or television. This is important because even though some churches may open, there may be members who are not yet comfortable congregating, or because of underlying illnesses, for instance, but it's still important to reach these members. Of course, if the decision is to reopen, there are certain protocols that must be followed, and all churches are asked to become familiar with these protocols. Members will not be allowed to gather for service if these are not in place. I wish to highlight a few of these. Number one, If there are members with underlying health conditions, adults over 65, individuals with disabilities, and members who are unable to wear a mask for the duration of the service, pastors are encouraged to hold a separate service for these persons or have them attend church virtually so that they get the full benefits of worship but are not exposed to the possibility of getting COVID. These persons, we know, are at higher risk of getting severe disease. To ensure physical distancing is practiced, church leadership is required to calculate the maximum number of persons who are allowed in the church building at any one time. This is done by placing markers on benches after measuring 6 feet in all directions around that marker. At the point where the marker is placed, this is where the member will sit. In other words, the persons in front, to the back, and both sides of a congregant should be 6 feet away. Number 3, to ensure hand hygiene is practiced, each church must have hand washing facilities, including adequate supplies of soap, water, and paper towels and hand sanitizers. A hand sanitizing station must be at each entrance, and all persons must sanitize their hands before entering. This should be encouraged also on exiting the church building. Number 4, all persons entering the church must wear a mask and do so for the entire service. This will help to prevent persons who are asymptomatic from spreading the virus via their droplets. Number 5, an effort should be made at beginning and again at a point during the service and at the end of the service to highlight the hygiene, sanitizing, and physical distancing protocols that should be observed, and there should be visible signs and posters encouraging congregants to observe the protocols and practices to prevent the spread of COVID-19. Number 6, church leaders are required to keep a register of all persons attending each service. This is to allow for ease of contact tracing in the event that someone in the congregation is diagnosed with COVID-19. We can then easily find the persons who attended the service and follow up with them. Now, I've outlined just 6 points today. So these are just a few of the areas I wish to highlight today, and will continue during the next briefing. As persons choose to go back to church, please keep in mind all protocols that must be observed to keep safe. Now, on another note, over the past 2 weekends, the COVID-19 Task Force, the Ministry of Health, the EOC staff, and volunteers have been distributing masks and hand sanitizers. We have completed the parishes of St. Paul and St. Thomas. The persons who met us were very receptive and very friendly. And we continue to encourage persons to use masks in public spaces as one of the measures to prevent transmission. So thank you very much.
Thank you, Dr. Judy Nisbet. And our final presenter is Ms. Sandra Maynard, who is the Director of Social Services.
Good evening to all. At Social Services, we continue to service the general public in various ways during the crisis. I have not been here every week, but Mr. Brian Dyer has been giving some of our statistics. As of the 22nd of May, we have serviced a total of 839 persons in a variety of ways. As of the date mentioned, we have received 610 requests for food assistance, and these were through a combination of calls to our 665-2501 COVID-19 relief line, community referrals, and persons are now walking into the office more often now that the civil service is back to normal operation. Additional numbers that can be called for assistance, 469-0720, or we can call through the switchboard and ask for extension 6290. In addition to food requests, an additional 239 individuals were assisted. So far, we have intervened in 5 domestic violence cases, seniors assistance and referral letters, 65, general help and assistance to seniors as a result of the crisis, approximately 16, PAP assistance referrals, approximately 97 persons have been assisted. Now, a lot of the PAP clients who have registered for this service saw their first assistance checks towards the end of April. But for those persons who applied but were not serviced at the end of April, we get very frequent calls about whether or not they qualified. It is important for me to note that we will not have information on whether you have been approved until the new batch of checks are issued for each month. So these should be available shortly for the previous month, at least by the end of this week. During the time you apply and the time that the check is issued, we will not have information on whether or not you qualified for that assistance. Our role is assisting with information and guidance on the application process, and once decisions are made in St. Kitts, we act as the distribution point at social services. And then the online application should be on your screen, www.stats.gov.kn. Of the 610 requests that we had for food assistance, we have distributed 410 vouchers/hampers as of May 22nd. And I would like to repeat the process for assistance with the vouchers. Once we receive your name and contact information, this is assigned to a caseworker who completes an intake form. And again, we would really like these to be by telephone. Once the vouchers are processed, you will get a call from the office saying when is pickup time. So until you get that call, unless it's a really dire need, we are asking that people do not flood the office. Once the vouchers are processed, again, you will get a call from the office saying when is pickup time, and pickup time is typically by Thursday afternoon and all day Friday. We are currently working on a turnaround time of about 3 to 7 working days for the callbacks and the issuing of the voucher. So we're really asking people to be patient. In essence, if you call or come in on a particular day, do not expect that voucher on the day you come in, or sometimes even during that week. We are also requesting that persons return the food voucher receipts. We have not been getting back these in the amounts that we need to, and we are reminding you that the receipts are needed for processing the payments to suppliers. For those persons who do not qualify I am using this medium to thank you for your interest and again to respect your right to apply. However, the food voucher assistance is predominantly for persons directly affected by the current crisis. And I mean through loss of work or loss of income. With regards to counseling and psychosocial services, we saw 14 new clients during the period, and these were engaged. We have done 22 counseling sessions so far. However, clients are still encouraged to understand that sessions are only being done by telephone, and the numbers for the counselors, again, should be on the screen. Before I close, I want to take the opportunity to publicly appreciate the staff of the Social Services Hot Meals Kitchen. They worked throughout the lockdowns, both partial and full, to cook and distribute meals to the elderly island-wide. There were no off days for these workers, even during their own personal anxieties, so we send hearty appreciation to them. Mrs. Margaret Keynes, Joyce Hendrickson, Isilma Wilkinson, Janice Mills, Theresa Brown, Tavares T. Brown, and Glenroy Turkey Skeet, our bus drivers. Thank you.
Wash your hands with soap and water. Having clean hands reduces the spread of diseases like COVID-19. Let's show you how to do it. After wetting your hands, close the tap. Add soap and lather your palms. The back of your hands, between your fingers. Back of fingertips in your palm. Your thumbs. The tips of your fingers in your palm. And don't forget your wrists. Use a tissue to open the tap, as this was last touched by your unwashed hands. Rinse your hands thoroughly. Finally, use tissues to dry both hands and discard in the bin. During this 50 seconds of hand washing, we had the tap running for only 7.5 seconds, saving 85% of water otherwise wasted. Water is a precious resource, and in some countries, it is scarce. So as you wash your hands, don't waste water. We are PAHO, and we care.
Thank you, Ms. Maynard, for your update from Social Services Department. I want to thank all our presenters, and now I would like to open up for questions from the media. I have questions. Shamika Budgeon of One Radio. It was stated by the Prime Minister during his address on Friday afternoon that churches are now officially reopened to the public as of last weekend. Could you provide the amount of persons that can now attend church services, funerals, and weddings?
Thank you for that question. As I mentioned earlier, when it comes to funeral, there will be no more than 25 members of the immediate family in attendance, no more than one officiant. Only essential mortuary personnel should be in attendance, and then the funeral should have a maximum duration not exceeding 1 hour. Weddings, no more than 25 persons should be in attendance. No more than one officiant should be in attendance. Only essential camera technicians should be in attendance. Only the 2 essential witnesses should be in attendance. And then the duration of that should be not exceeding 1/2 hour. In terms of church services, once the pastor or the elder of the church would have carried out the necessary social distancing markers that will determine for that particular church the number of persons they're going to permit at any given time of service. So the regulation did not speak to the number of persons in church, but they must be able to meet the requirement for social distancing, which is we have the 6 feet marker, left, right, back, and front, east, west, north, and south, whichever you want to use. And I know that was clearly stated by Dr. Nisbet when she was giving her presentation. So I do hope that answers your question. Thank you very much.
Thank you, Superintendent David. Question from Shamika Budgeon of On Radio for Dr. Judy Nisbet. Since the regulations have now loosened a bit, are there any changes in persons visiting the elderly at the nursing homes or the sick at the Alexandra Hospital? Could you shed some light on this? Thank you.
Thank you, Ms. Budgeon, for that question. There are no changes in the visiting, in terms of visiting elderly at the home. The regulations are still in place, restricting visitation. So no person shall visit or be permitted to visit a patient in a residential care establishment or facility, including an elderly nursing home. So that's clearly stated in the regulations. The visiting hours for the hospital remain the same.
Thank you, Dr. Judy Nisbet. I want to thank all of our presenters and the media houses who have joined today, and to remind persons to adhere to the regulations of the state of emergency, and to protect yourself and others by washing your hands often with soap and running water. Cover your cough and sneeze with a tissue or flex elbow and dispose of the tissue in a closed bin and wash hands immediately. Avoid touching your eyes, nose, and mouth with unclean hands. Disinfect touch surfaces and areas often. Eat lots of vegetables, dark green leafy vegetables and other types. Eat lots of fruits. Drink plenty of water and exercise often as possible to stay fit and keep your body strong. Continue to practice physical distancing and stay at home if you don't need to move about. These are some of the measures that we keep repeating so that you can stay safe and protect yourself and protect others. Our hotline numbers are the same, 311 or 661-5051. And please remember to sign up for the NEVIS Health app. The web address is on the screen. Also, you can scan the barcode. And I want to thank the NEVIS Disaster Management, NEVIS Television, Caribbean Digital Displays Limited, Cornerstone and Task Force member for making these briefings possible. I am Nadine Catty-Keynes. Please join us on Thursday, 28th May at 8 p.m. for another edition of the NEVIS COVID-19 briefings here on NEVIS Television at 8 p.m. Thank you for viewing. Please do stay safe.